Thank you very much indeed for the invitation and the introduction. And it builds very nicely on what Marco just produced. I'd like to say I didn't just come up with the idea. This was a collective endeavor where we realized very painfully that there needed to be another route to influence compared with the very obvious one of producing the data that demonstrates that this can actually be done. And I think I want to start, I thought Marco would actually cover this, but I was going to say we understand perfectly well that what we face now in 21st century healthcare is unsustainable. The aging population, the complexity of multifactorial disease in the elderly population increases with that longevity, and those treatments clearly are poorly addressed in many instances. And therefore, we have an exponential increase in healthcare costs, and this is going to bankrupt a small economy at some point in the future. This has to be addressed. And it's no surprise to hear, I'm going to tell you that one of the solutions that's been proposed, and as you've heard now, is that modeling and simulation has a role to play in being able to improve the quality of delivery outcomes and in reducing costs. And there's a lot of evidence out there that has been going on for a long time. This is a PricewaterhouseCoopers report that was published in 2008. So it's known that this stuff can happen, but it's not been embraced and adopted. One of the things that struck me yesterday in listening to how the 3D technologies, the 3D printing technologies have been adopted very, very rapidly is why has modeling and simulation not enjoyed the same kind of popular uprising and acceptance? And I guess part of it is to do that you can have something really nice in your hand that a surgeon can play with, whereas modeling and mathematics and physics may be a little bit more difficult to understand. So why do we need to build bridges if the evidence is out there? Well, despite that evidence, as I've just said, the uptake has been, I wouldn't say poor, but it's actually been restricted to certain areas and it's not been embraced fully. And why is the reason for that? Well, partly I've just mentioned as coming to a sort of light bulb moment a moment ago is surgeons probably can't hold something in their hand. But it's something to do with uncertainty, I think. It's partly to do with all models that are out there we know are wrong. All models have a degree of uncertainty in order to be developed. But for whatever reason, animal models and cellular models are more accepted than mathematical models. And I think that that's got something to do with familiarity with that which has been around for a very long time and the background that you've come from. As a biologist, I left maths at the age of 14, and I'm still bamboozled when you see these equations up on it. But I accept and I understand that it has a role to play. And I think that is not necessarily always accepted. The other thing is around validation, verification, and acceptance by regulators, and indeed, middle and senior management, in an understanding with the bean counters that this has got something that can actually deliver. So we started to think about a roadmap to adoption, and working with Marco and the VPH Institute, we went to the European Commission and we got a funding for a research project which was called Avicenna, a strategy for in silico clinical trials. And I guess it was a bit of a misnomer because it's not just about the in silico trial. This is about how modeling and simulation can have an impact both on outcome, quality, reduction of cost, speed to market in the entire value chain, whether you're in pharma, whether you're in the device industry, whether you're in the software industry, whether you're in the cosmetic industry, any industry where you can apply a mathematical model in that way is relevant. And the in silico clinical trial part it's patient-specific, and it's a way of ensuring that you can actually deliver in the way that Marco's just described very, very beautifully. This delivered a roadmap about 18 months ago. It's been published and it's accessible online, where we had a bunch of recommendations, including around training and education, something which is absolutely on the critical agenda at the moment for all of the reasons we know in Europe, needing to develop skills in this area. But interesting also in the area of policy, in the area of trying to influence policymakers and regulators on what needs to be done in order to adopt this more broadly. And you can pick that up online, as I've said before. This project ultimately led to a dialogue with the European Commission. We had a series of meetings with them where they kept on asking, well, okay, you've delivered the roadmap, it was a really good project, what then? What do you do? How do you take on? What happens after that? And the suggestion, in fact, it was almost a request that came from the Commission afterwards, was that we should set up a public-private partnership to actually implement or take on the challenges of the roadmap. That was a huge ask. A PPP is a massive legal undertaking, but we agreed that the thing to do would be to create an association that was a partnership between academics and industries that are interested in modeling and simulation. And it's market-focused. Oh, sorry, back again. It's market-focused from the industry perspective, and established at the request of the European Commission, and it has the origins, as you heard from Marco. Essentially, this is a success story for the European Commission, if you want to look at it. It's one success story. It's a long funding track record from around 2005 that's ultimately led to the creation of something that is going to hopefully have material benefit in terms of influencing policy and outcomes. And in particular, it has its seed in the roadmap for clinical trials. The purpose is to address the regulatory barriers and to develop policies on in silico medicine, but not doing it in isolation. It goes back to some of the things that came up in discussion yesterday. It's actually getting the stakeholders around the table working together to develop that policy as we go forward. And we know that technologies advance far faster than policy and regulatory will do, and they need to catch up together. So the definition for us in terms of predictive medicine, it's where in silico medicine is the use of computer modeling and simulation in the diagnosis, treatment, or prevention of a disease, and it contributes fundamentally, in our view, to the delivery of personalized medicine. And in the interpretation and the processing of big data, huge data that is, as you heard a moment ago, that is being delivered to the clinic at the moment, into actionable information. This also came up in Dr. Morris's talk yesterday. It's taking that data and being able to do something with it because you understand what it means and it tells you where you can go next. A sort of modified slide from that which Marco had a minute ago. And we're getting data from all sorts of sources. It's not just about acquiring information and then doing the analytics and getting a snapshot. It's maybe about getting that data in a quantitative data and be able to use that data to fit into a quantitative model that can be used to predict in a way that currently is not being done. So that's a real challenge. The important thing here is, as we've discovered recently, is that a lot of this stuff doesn't have a regulatory oversight. 23andMe encountered a problem not so long ago where they were delivering advice from the genetic tests that they were producing, and they had their wrists slapped by the FDA saying you can't do that because essentially you're then putting yourself up as a device. And so the point now is, how do we work with the advancing technologies and the policymakers and the regulators to ensure that that which is being interpreted from all of this data can be used legitimately to inform patients and clinicians on best practice and going forward. And we've had some clear examples around the clinical trials regulation. We had to catch up very quickly on this, and also the data protection regulation. And mHealth and eHealth is high on the agenda. There are some areas now around wearables, for example, where there is no regulation in terms of taking this forward. We had a couple of questions yesterday as how this relates to 3D printing in a hospital. At what point does regulatory come in order to ensure that that which you're delivering to the patient is safe in particular and fit for purpose? So regulators are all over this now. I mean, this is a slide from Tina Morrison at the FDA, basically saying that the FDA now are looking at this in a strategic way across all agencies, looking at the modeling and simulation. They have now a strategy for the agency to look at how modeling and simulation can be applied, not just in the device area where they have a very strong track record already, but also now in pharma and in biopharma and in other areas of the agency's interests. So what's the alliance? So the alliance structure is essentially, as I said, a partnership between academia and industry. The industry are healthcare industries, whatever flavor. We have, as you'll see in a minute, both pharma and devices as well as software represented, who pay to be part of the alliance. And the academic representation is, naturally, the evolution from the VPH, the virtual physiological human, and it's the virtual physiological human membership that are the academic partners in this relationship. They don't pay because they pay to be part of the VPH Institute. So it's 50-50 at board level, one-to-one representation, and we have 3 working groups around policy, which is about clearly shaping policy around international affairs. This was actually quite important because when we spoke to our industry colleagues, they said, this is all very well you guys doing this in Europe, but what happens in the States? What happens in Japan? We have labels attached with our product, to our products in these different areas, that if we don't have harmonization of policy, we've actually got to go through an entirely different regulatory process in different territories. So from the start, I was going to say dialogue, but it's almost like a trilogue, a discussion with all of the regulatory agencies to say, how can we lay the foundations for harmonization of in silico medicine policy from the start, rather than doing it post hoc? And that's a challenge. Research is about obviously responding to proposals from the Commission and elsewhere, industry and academia working together, building skills, partnerships in terms of exchange programs between industry and academia to help build the skills, not just at the academic level, but in understanding how you translate the academic into something which is important in industry. And I think that's going to be really quite important going forward. So the vision is that we will develop, hopefully, a common policy framework, an agreement on international guidelines, as I mentioned before, encouraging policymakers to learn from the past and understand how not to repeat the mistakes of the past, and hopefully that we become an interlocutor between the different stakeholders in this area, representing modeling and simulation in healthcare, that can help to advance that dialogue, not just between industry and academia, but including other stakeholders as well. And this is how we see the framework to build confidence. From our perspective, if we go back to what happened with genetics in around 2003 and 2004, when genetic variation was being mooted in terms of importance to pharma and the pharma submissions, it was, I think, the FDA's move to include genomic and genetic submissions in their dossiers voluntarily that actually began to stimulate more research in that area and to include, without any risk, that information in dossiers going forward. I think we see now, potentially, that modeling simulation is at a same stage, where if we can get policymakers to create an environment that encourages the use of modeling and simulation in a non-threatening, sort of voluntary way, that will then help to build confidence. That itself will stimulate research. Through that, will help to produce examples of validation and verification, which will build confidence and ultimately, hopefully, lead to the adoption more broadly in the healthcare community. And as I said before, it's a partnership of industry and academia, but includes regulators, patients, clinicians, and academia in the discussion. Where we stand today, it's a legal entity from last July. We're only a year old, just over a year old. We're working already very closely with the FDA. We'll be there in May to create memoranda of understanding, and also the commission that will allow them to become observer members of the Alliance to help in the discussion at a hands-off way without any risk. We're also talking to the Joint Research Centre, an important, very important European Commission entity in Italy. We've just become members of the European Forum on Good Clinical Practice. There's a reciprocal association which brings ethics, patients, and clinical into the discussion. And we're hoping to build connections with the Japan regulator when we can get in touch with the right people. We had very successful track record in including modifications to the tests for the new texts for the regulations on medical devices, and the European Medicines Agency, where now in silico is included as part of the requirement. And we were launched officially and formally in the European Parliament in October. So in a nutshell, the time is right. Industry and academia working together. I think I've sort of beat that drum quite a lot. Focus on providing input to developing the policy framework, responding to consultations, having the experts both from industry and academia being able to provide that evidence that will inform policymakers. Focusing across industry sectors, expert input into consultations, evidence into build confidence of technology applications that I've described, and working with the regulators from the start to make sure that we're actually relevant going forward. This is a current list of the growing membership. Medtronic clearly was one of the founder members, along with ANSYS and more recently J&J, which was a corporate level, global corporate level membership, which covers healthcare, pharma, and devices. And a lot of the key insignia, clearly the key academic centers, including one from Auckland, that will be part of this partnership. Thank you very much indeed.